Good afternoon, this is TTT Live and TTT Live online on Facebook. I'm Dike Rostant with a COVID-19 review. One more COVID-19 patient has been discharged, bringing the number of patients discharged to 109. Chief Medical Officer Dr. Roshan Parasram said today that the last person who tested positive on returning to Trinidad and Tobago has received the all clear to leave the home of football.
However, the patient was offered to leave, but decided to stay with their family members until their discharge, which would be in a couple of days once they receive their final negative test.
And while there have been no further positive confirmed cases, with the figure remaining at 117, Dr. Parasram says there remain some 39 persons in the parallel healthcare system.
Our 52 returning nationals from the Disney Fantasy Cruise would have been discharged starting this morning and complete by the end of today, leaving in Cascadia 2 persons, in the Tacarigua facility 29 individuals, and healthcare workers at Napa 5. At the home of football, we remain at 3 individuals.
And the Ministry of Health continues to urge citizens to uphold the mantra, no mask, no service, reminding members of the public that the public health guidelines are there to protect them in this COVID-19 pandemic. Health Minister Terence Dialsing has expressed concern about what he has been seeing taking place.
I am again appealing, as we open up the economy more and more, that companies, organizations, businesses, small, medium, and large, please enforce the no mask, no service policy. And it is not good enough to just have a sign up saying no mask, no service. Because I went to fill gas in a gas station, walking up to the teller who is behind glass, I saw the sign, no marks, no service. So when I see the signs, I feel good. I say, aha, the message is getting through. No marks, no service, they can't get gas. I went up, I paid my $200 Minister Cox. And as I was walking away, the man behind me had no mask, walk up, and he got gas. So the advice to people and store owners and business people, having the sign up is nice, but we really have to live the policy.
So I guess the minister is talking about walking the talk, but we are moving on to another item of news. Defense Lab Global was born out of a desire to study the science of defense in order to create functional training programs. Rondel Benjamin is a multidisciplinary martial artist and the regional director of the Caribbean, Central and South American branch of Defense Lab Global. And he is here with us to speak about the launch of a new Defense Lab training program. Good afternoon, Mr. Benjamin. How are you?
Bonjour, tout le monde. How are you doing? Everything all right?
I'm not even going to try to get into that with you, but talk to me about this new course outline and the need for a course like this. Thank you.
Well, about 4 years ago, we at Defense Lab recognized that we needed to reverse enforcement and professionals that take into consideration science, physiology, and just the basic understanding of psychomotor function. Classic example, if I'm using pain compliance, but I'm applying a wrist lock and asking you to remain calm, those two create cognitive dissonance. They don't work. I can't hurt you and then tell you don't move. And so what we try to do is use martial technology, modern science, and our understanding of the brain to create a new program that allowed us to apply all these skills that we had access to in a way that safely protected both the person who was resisting and the person who was trying to control the situation.
Now, you're saying that, and all I'm thinking about is a parent beating a child, and it's a no-win situation. Because if you don't cry, or you're not crying, I'll give you something to cry for. If you're crying, why are you crying? But in terms of the release, the timing of the release, is there anything special about it? I want to give you the opportunity to state whether or not anything is related with it.
It is coincidental in that 4 years ago we went to Spain and we did all the filming and the product was ready to launch. I personally, among the Defense Lab disciplinary committee, kind of conflicted about the time of release because I don't want it to appear as if we're releasing the product in response to what's happening with George Floyd and the global movement for Black Lives Matter. Instead, what I did recognize is there's a responsibility from those of us who have information to get the information out there quickly, to support those who need it so that we may prevent cases like this from happening. My specific focus is our region, Caribbean, South, and Central America, where I believe the law enforcement personnel don't have the same issues as U.S. law enforcement, but they have a series of very complex, nuanced challenges, and we need to give them the best technology we can to do the best job they can to take care of us and themselves.
So as someone with that body of knowledge, who is the first group that you're looking forward to sharing this knowledge with? What's your target grouping?
My target group when I came back to Trinidad was to serve law enforcement, military, and in Trinidad we have a unique case where a lot of the security personnel technically are law enforcement because they are generally fall under the Estate Constable Act. For some reason, I've never really been able to serve that community well, be it politics, be it profession, be it the invisible lines that Trinidad creates in terms of being able to give information to those who are in service to us. So right now, I have, as a civilian, offered the product and support to anybody in law enforcement, military, and civilians who need it, especially nurses, doctors, people in medical staff who have challenges with patients who may be intoxicated under the impact of drugs, maybe having a psychotic episode. These are all professions that desperately need the ability to help manage violence and conflict. Our secondary school system, staffs and teachers desperately need these skills because I strongly believe that if these personnel in the service can demonstrate that they safely and carefully can help people who are acting out violently or experiencing violence and help them to find a different way of doing it because they're coming from a place of skilled confidence rather than fearful ignorance, then we have a chance to create the deep kind of change I want. So really it is for anybody who feels that they're in situations where there's going to be conflict and where they want to be able to resolve it simply, effectively, with the least amount of harm possible. I would love to serve our local law enforcement and military, but I have found that to be an extremely complicated process, and to be honest, I've kind of given up on that hope.
Now, speaking of local law enforcement, there was just the use that was touted as the first time it was of nonviolence in the sense that an officer, a law enforcement officer, used a taser on an individual. I'm wondering what kind of methodology currently obtains, and does this new training complement what is there, or is it better, in your opinion, than what is already here?
I have to be very careful about commenting on the Trinidad and Tobago Police Service. I know they're doing everything humanly possible to upgrade their skills. They have a bunch of very professional people who are doing the best they can. I have my personal feelings about tasers because I've done a lot of research and study in the U.S. And you'll find in the U.S. Supreme Court that there's several cases where tasers produce death if not properly utilized. For people who have issues with their hearts or have contraindications, high blood pressure, age, there's several factors, right? What I want to do is ensure that whatever toolbox is available to them has all the tools they need to do their job. I believe in the right hand, a taser can be a tool. It's a tool that is for extreme use only, but I believe that our law enforcement is capable of making those kinds of decisions. If they understand the physiology and biology, they understand use of force, they understand empathy, and they're deeply in solidarity with the communities they serve, I strongly suspect they'll be able to make the right decision. It is critical that those of us who have information and knowledge come forward and do the best we can to share whatever information we have to give them the best chance possible to be as effective as they can be. But I personally, based on my personal research, feel very uncomfortable at this present time with the introduction of tasers because of the global impact it's had in terms of death in service and the amount of lawsuits pending at present time. But I trust that they have done the research I've done, and if they implement with care, I'm sure they'll have success.
Thank you so much. In terms, moving back to the topic at hand or the new course, is this a one-size-fits-all approach? Is everything that was done 4 years ago applicable today?
It is extremely cutting edge. My hope is, and when I committed to helping develop this course, what we're seeking to do is collect all the best information from around the world and pilot a new way. We are applying it as cutting edge. For too long, we've been very reactive and accepting European-based systems of control and defense, and not really reaching into our own cultural context, our own research, our own science, and coming up with methods that are new and cutting edge, and in many respects are ahead of the curve. So this is my attempt using online media, because it's an online course, to get the information into the hands of the experts. By making it online, they can actually avoid having to use civilian instructors, access the material themselves as professionals, and if they need additional support, I'm here as a Trinidadian fully committed to the region. But I think one of the keys to creating our offering was to create an offering that bypass the bureaucracy and bypass the bias that a lot of agencies have against civilians bringing new material in. So it is really, I really commend Tony Torres and the Defense Lab team globally for having this vision and for inviting me into the vision and allowing us as Trinidadians to be on the very cutting edge of development. And hopefully we have something that can make a genuine change. And so anybody who is interested, just contact me, Defense Lab Trinidad. They can contact the Defense Lab global page, access the material, and then I'm very, very available to answer any questions and give people in-person support. Because it's an online course that was designed to be supplemented by live contact training with qualified instructors.
And I want you to take me through that process a little more, please. How do you train virtually? Is it that I need to get a group of people together and then sign up, or is it that I can do it by myself in a space that I have for myself? How does that work?
Different levels of application require different levels of investment of time. There's enough quality information that somebody by themselves can view the material, follow along with the drills, maybe get one training partner to start working their way through the material to generate the kind of questions and to generate the kind of friction that will force them to evolve and develop. Now, at a higher level of application execution, study groups is an exceptional way to proceed. And then a study group that has access to the online material that then contacts a live instructor who can come in and bespoke or customize some of the materials to their specific unit, organization, or to their application is then the way to proceed. One of my hopes quietly is that Trinidad as a country accepts some of this material and sends some of our best professionals to become certified, and then it can spread organically throughout our country and organizations and engender the kind of change that I've prayed for. I'm very, very committed, and I believe that we can do better, and to do better, we have to have better tools. And so this is one of the small ways we can offer to the globe a better tool, and a better tool that is designed to allow people to absorb the material quickly and to be able to apply it under pressure, because it is not only based on cognitive accessing of the material, but it's really built off of the instinctive and intuitive responses humans have to stress. And I think that's the real secret in this system. That they
But
figured out
in
the human
terms of
survival
having a real
mechanism.
secret, though, Mr. Benjamin, don't make your contact information a secret. Just before we go, give us your contact information. Thank you.
All right. Anybody can call me at 498-2609. I'm on Facebook, either on the Defense Lab Trinidad or Rondel Benjamin. Trinidad is a small place. I'm sure anybody who's looking for me could find me.
Thank you very much. That's Rondel Benjamin, the Regional Director of Defense Lab Global. And I appreciate the fact that he spoke about using empathy as one of the things that you're going forward with. But that is what is trending on COVID-19. Remember, you can join us for live coverage on TTT, Chalk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, as well as on Facebook at TTT Live Online for all your COVID-19 updates. Thank you for joining us on behalf of the TTT crew. I'm Dike Rostant. Thank you for tuning in.